think it's twofold. There's anxiety or fear from our patient and community coming into the clinical space, the potential risk of exposure. Then the second factor is due to short staffing, the access is not adequate.
The thing that's been most disturbing for us as providers is that we've seen childhood illnesses that are related to lifestyle habits throughout the pandemic, and now as we're coming out of it, more children are presenting to the clinic with prediabetes, with non-alcoholic fatty liver disease, and with high cholesterol levels that we're not used to seeing. And I think the rate of prediabetes has really been shocking for those of us, especially for those of us who do this work all the time. Just seeing those rates increase exponentially has been really shocking.
The children that weren't active pre-pandemic and gained a significant amount of weight are not going back to their pre-pandemic weights.
They were not able to go to the park and exercise. That increased their weight significantly. And also anxiety and depression because they were isolated. They were not able to see their friends. Many of them were also so anxious because they were afraid of being exposed to the virus.
I have a significant portion of my patients that still are facing challenges with anxiety, and then a fair number that are also dealing with challenges around depression, which also limits their willingness to engage with other people, to be outside, to be physically active.
Unfortunately, with unintended fallout from the COVID pandemic, we are seeing an abundance of children who have developed unhealthy habits. These unhealthy habits include excessive screen time, which has displaced physical activity in large part, and also unhealthy eating habits and insomnia as well. It was not uncommon that I was seeing double-digit numbers, so 10, 11, 12 hours a day of reported screen use, which displaces sleep, physical activity, socialization in person, and in effect, actually resulting in lower academic performance as well.
And now what we're really seeing is even more long-term effects. We're seeing more and more cases where we're bringing children to the operating room, and instead of being able to fix all of their teeth, we're extracting 50% of their teeth. That also then has increased our wait times for children to get to the operating room. We're currently at about a 6-month wait time. We're seeing more and more kids whose BMI is very high, and that also impacts their care because traditionally we could sedate some of these younger children in the office with just an oral medication. But because they're obese, it's unsafe to do this in the dental office. I think there's a lot of stressors on the families this past 2 years, and a lot of them are just trying to cope. And often dental and healthcare take a back seat.